explanation. So, you know, how is she left? How long is she left alone? How big is her crate? Is it like this big? And she's just playing over here and playing over here. And what other, you know, how else is the house training going? Where does she sleep? And all these questions, you know, that need to be addressed, and they take time. I enjoy behavior, so I don't mind taking that time. But those are, yeah, some examples of things that I would address. And then Maddie has this ear infection that's not going away because she doesn't like her head and ears messed with. So that sounds like a medical issue, and certainly if her ears are painful from the infection, we need to get that addressed. But if an owner can't administer medication, so this is another example where, you know, help your dog get used to handling all over, toes and ears and mouth. Always need to be working on those things because you never know when it's going to come in most handy. So, like you, I'm guessing these are very similar complaints to what you get.
Nielsen is ready for discharge. Sammy Nielsen is ready for discharge.
So, you know, lack of house training, whether that's just insufficient house training or an actual medical problem. Of course, we always need to rule that out. If we're not using the litter box or having accidents in the house, we need to rule out medical problems first. Excessive vocalization, leave the dog out in the backyard and it barks all day at the neighbors. How can you know? Yeah, those are fun. I don't have a magic bullet for that either. And it's not a shock collar, it's a Chanel collar, necessarily. The anxiety problems, separation anxiety and other anxieties, and to some degree aggression is, I feel, frequently due to fear and anxiety. Those, I think, are definitely areas that benefit by involving a veterinarian. In fact, I think that's my next slide. Well, before I go on to the next slide, how does my list compare with what some of your common things are? What am I missing?
Holds on leash.
Ah, yes, walking behavior.
And
Jumping, obnoxious. I almost put destructive behavior on there, but I'm like, no, people don't really come to me with the destructive problems. So,
I think a lot of dog activity or leash activity. We get a ton of that. I get a ton of bite.
Dog and
Well,
and
yeah,
dog
a lot of dog to human
Yeah.
relation too.
Yeah.
A ton of it.
Yeah. I mean, I guess it's good, but you'd rather not.
Yeah,
I know.
expect that much.
I think, you know, ones that are appropriate to involve a veterinarian is really, I'd say, most or all types of aggression. I think it's important to evaluate the dog. You know, is there a medical reason that the dog is being aggressive? You know, do they have painful ears or painful hips? And so really need a medical evaluation.
So when we send someone to the vet and say, make sure that there's nothing wrong, make sure that their eyesight. We had a dog that was having trouble seeing and startled, you know, and but we noticed that because waving a hand and the dog's not following is a problem. Do you have some kinds of questions that we can have and ask their vet so the vet doesn't do just a general exam and say everything's fine, which happens a lot?
Yeah. So and sometimes when we talk about like doing some blood work, checking thyroid levels and things like that. So I would say, you know, if you notice things like especially the vision, make sure, you know, take him to your vet and have him check him out, check his eyesight, you know, if he's, hearing, those kinds of things. Although we know as veterinarians, it's really hard to test hearing. We can't really say, you know, raise your paw when you hear the beep.
Yeah.
So testing hearing in dogs is hard. You know, trying to, things that they used to respond, sounds that they used to respond to, like opening a treat bag or their favorite words, kind of checking, you know, kind of those fail-safe things. But yeah, checking hearing. The true way to check hearing in dogs is when they are actually sedated. And I don't even know if they do it here if you have to go to K-State, but they hook up these like little electrodes around the head and measure brainwave activity to sound.
Wow.
Yeah, so that's the way to like truly diagnose hearing loss. So it's in a practice setting, it's pretty subjective. Just kind of, yeah, it seems like he doesn't hear very well. Yeah, I think, just kind of, if there's something you suspect, you know, have, be sure to mention that. But in general, like a dog who's aggressive, I think it's important to do some blood work. Now, I don't necessarily, like in a young, healthy dog that's like 1 or 2 years old, because 1 to 2 years old, aggression, that seems to be, you know, that's, they're reaching that social maturity and they're showing, they're kind of becoming more aggressive, or it's getting to a point that the owners can't handle it anymore. I don't always test thyroid in those dogs, and I can't even say that I always check blood work in those dogs. I guess it's very case dependent, but doing a full exam and checking them over and getting a full history to help rule out